Okay, we're just admitting everybody from the waiting room. All right, we can get started. Hello, everyone. Welcome, ahlan wa sahlan, to today's talk from Scientists for Palestine. The talk is titled The Story of the Samir Foundation, From Under the Rubble to a Brighter Future for the Palestinian Healthcare System. My name is Professor Dima Totah. I'm a member of Scientists for Palestine Steering Committee, and I will be your moderator for today. First of all, I just wanted to make sure everyone is aware that this talk is being recorded, and by participating, you consent to be recorded. Throughout the talk, feel free to write your questions in the chat, and our organizers will collect the questions, and I will ask them at the end to our speaker. I wanted to, first of all, thank the webinar committee of Scientists for Palestine for organizing this webinar. And we are very honored to be joined today by Dr. Izzeddin or Ezz Lulu. Ezz is a medical doctor from Gaza, currently in Gaza, and he's the founder and CEO of the Samir Foundation. This organization focuses on humanitarian health and medical education in areas affected by crisis. Dr. Lulu is actively engaged in global health advocacy, working to raise awareness about the humanitarian situation in Gaza. He has experience in leading international collaborations, coordinating medical training initiatives, and advocating for healthcare equity in conflict zones. Through his professional efforts, he strives to amplify the voices of communities impacted by these crises and improve their healthcare systems. Welcome, everyone, and welcome to Dr. Ezz. I will give the floor to him now, if you'd like to share your screen.
Assalamu alaikum. Thank you so much. Thank you for having me today. Just give me a second to share my screen. Mhm. Okay. Mm, Yeah, can you see my screen, right?
Yes, we can see your screen.
Okay, thank you so much for having me today, and thank you for Scientists for Palestine for this meeting. Appreciate your efforts to stand with Gaza's people. Actually, to shed light on the truth of what is happening here is the first step toward the future. So, first of all, again, thank you for being here to listen. My name is Izzeddin Samir Lulu. I'm a medical doctor from Gaza, the founder and CEO of Samir Foundation. Uh, Today, I'm not just here to talk about an organization. I am here to share my story and the story of what we are trying to build despite everything happening around us. Uh, Actually, the ceasefire is just only a temporary relief, but the devastation is overwhelming. Uh, As you see, people are returning to their homes only to find that those homes no longer exist. Entire neighborhoods have been reduced to rubble. Personally, my own family is still under the rubble till now. to this moment that I am talking to you, and I'm still waiting for equipment to enter Gaza, just to be able to bury them in a place that honors them. This is the reality we are living in today. I live every day with a mix of two things, grief and determination. Grief for the lives we lost, for the suffering my community continues to go through, and determination to rebuild, to restore hope, no matter how difficult or how long. So, before all of this, my life was very different. I was a medical student. I was a fifth year medical student, and I was also an artist. I had been working in illustration and character design, uh, even collaborating with international platforms. People in my community used to call me the smile maker. I would draw people, surprise them with their portraits, and create moments of happiness. I used to sit on sidewalks, sketching strangers' faces full of lives, unaware they had one day will become a memories, you know. And back then, finding a reason to smile was easy. Um, as well, before the war, I was also honored to be selected as the European Union Goodwill Ambassador for Palestine. I believed in impact, in voice, in making a difference. But most importantly, I was a dreamer. I believed in a future where I would become a doctor, serve my people, and build something meaningful. But after I got the title of EU Goodwill Ambassador for Palestine, the genocide started. The last normal day in my life was October 7th. For who didn't know that October 7th was my birthday. I am 2001, and in that day I spent it with my family, laughing and celebrating. It was a normal day. Uh, that night the bombing started, and without realizing it, that was the last day I ever saw my family together. And on uh, October 8th, our home was bombed in the second day of the war. At first, I thought losing my home, my house, was the hardest thing because, as you know, a house is not just a walls, it's a memories, safety, details of life. I lost my home, my art, my past, and I thought this is the worst it gets, but I was wrong. This is the picture of my father, and next of me, my mother as well. The picture took on October 5th, 2023. I chose to volunteer at a Jifa hospital when the war started because the scale of catastrophe was beyond what the hospital staff could handle. Even though I had no official graduate yet, but I found myself in a situation no textbook could prepare me for. Inside the hospital, there were long hours, little sleep, and constant pressure. The hospital was surrounded, no electricity, no communication. For one whole week, there was no electricity, no any communication. Snipers were targeting people inside the hospital corridors, and we couldn't even reach them to save them. I watched people bleed to death. And also, I took this picture from the window of Achifa Hospital in front of the tanks. Oxygen ran out, and patients just died before my eyes. And for the first time in my life, I buried people inside the hospital. 9 p.m., 13th November 2023, almost in 1 month after war started, I was still inside Al-Shifa hospital, surrounded by the occupation forces, cut off from the outside world. And at 9 p.m. clock, I received a call from another hospital. And he said, "Ezz, we are sorry for your loss." I didn't understand. Then they said, "Ezz, your family has been killed." In that moment, everything collapsed. And they told me that my father, my brother, my grandmother, my uncles, my cousins, my nephews, even my pregnant sister-in-law, 20 members of my family were killed in one airstrike. And to this day, they are still under the rubble. Not only did I lose them, I lost the chance to say goodbye. I lost the chance to bury them. I had in the hospital, I had already seen horror, but I saw patients die because oxygen ran out. I saw people shot inside hospital corridors. I saw things no human being should ever see. But nothing broke me like that moment, like that call. Because in that moment, I was not just a doctor, I was a son, a brother, a human being who had just lost his entire world. I remember while I besieged at a hospital, the Red Crescent told me that they heard screams from where my family was targeted, but their equipment had been destroyed. And I keep asking myself if they had that equipment, maybe, just maybe some of them would still be alive today. And my brother and my father and my nephews and my pregnant sister-in-law, they are still under these rubbles that you are seeing in this picture. And I just took this picture yesterday. But as you know, there is no heavy equipment in Gaza to get them out from the under the rubbles. I walked through hell with open eyes, and when I reached the bottom, it was quiet. It was empty, and I had to ask myself, what do you do when you have nothing left? And then I remembered my father. He raised me to serve, to give back, to heal. I lost his voice, but I still had his values. And in that moment, I made a decision. I decided that this would not be the end of my story, that this loss would not define me, but would build me, that I would take this pain and turn it into responsibility. That's when I founded the Samir Foundation. I named it after my father, not as a memory of death, but as a commitment to life, a commitment to continue what he taught me. So we founded Samir Foundation in 2024. I created this foundation to support medical students, to support my colleagues who continue studying under bombardment, under displacement, under starvation, to support healthcare workers who refuse to leave their patients, and to support a healthcare system that is fighting just to survive. Alhamdulillah, after 2 years of started this foundation, became one of the biggest medical organization in Gaza that support medical students and doctors and healthcare workers in Palestine. We provide financial support to students who cannot afford education anymore. We build learning spaces in places where everything has been destroyed. We train, mentor, and connect students globally because education is the only way to rebuild a healthcare system. And I think that most of you saw the last graduation ceremony that was held in Al Shifa Hospital. It was one of the biggest medical graduation ceremony happened in Gaza, and we graduated 230 medical students from all universities of Gaza in the class of 2025, and we named the graduation Phoenix cohort. Today, we have supported over 700 medical students across the Gaza Strip, provide aid to more than 1,600 individuals, healthcare workers, and build spaces where students can study again. Because these are not just numbers, these are lives. These are lives that refuse to stop, inshallah. Today, also, we have built a global network of more than 350 ambassadors across 47 countries, represented Samir Foundation in their countries, and one of the incredible programs, Samir Foundation ambassadors, doctors, students, researchers, professors, all working together for one mission. So I went from the smile maker to someone trying to rebuild a healthcare system, from drawing faces to trying to protect lives. So this is me, Izzeddin Lulu, a medical doctor from Gaza. And the war actually took everything from me, from the people of Gaza, my family, my home, my art, my goals, but not my purpose. We are not victims, we are numbers, we are seeds. And even in the rubble, we rise. So don't look away. Don't let our stories fade in silence. Stand with us, not in pity, but in purpose. And this is what I build from the ashes. Thank you.
Thank you so much, Dr. Ezz. This was
You're welcome.
sorry. Oh, yep. This was just an incredible presentation, and I'm sure your parents would be very, very proud. The level of success that you've achieved in such a short time is also very impressive. We have a few questions that were sent over. So let me start with the first one. What are the biggest challenges that your organization currently faces? Is it staffing, resources, coordination, both internal and external challenges?
Could you repeat your question?
What are some of the biggest challenges that Samir Foundation organization faces? What is makes it difficult to do your work?
Yeah, I think from my perspective, one of the biggest challenges that I'm facing and all people facing here in Gaza is working in environment that is still unstable and unpredictable, you know. So we are trying to build long-term solutions in a context where even the short term is uncertain. Uh, Infrastructure is damaged, resources uh, are limited, and the needs are constantly increasing. But beyond that, the sustaining momentum, you know, so while the crisis is still ongoing.
Exactly, dealing with it under these political pressures and
Yeah.
genocide. And it's just really, really honestly impressive, the spirit with which you continue the work. And thank you so much for sharing this difficult story with us as well. If people are interested in joining the foundation and supporting the foundation, what is the process to join your global network, to support it financially in other ways? Could you talk about how we could help?
Yeah. If they visit our website, our official website, they will find a section named Join Us. So they can join the foundation, and inshallah, they will be one of the our mission, inshallah.
And are you looking for specific skills, or anybody with any background
No,
could support?
anybody with int have really interesting to make a difference in lives of Gaza. Uh, if uh, if they are medical students, doctors, humanitarian workers, and so on.
Mhm. Mhm. Um, and I'm looking now. So, uh, for you, considering all of the challenges you're going through and the um, achievements that the Samir Foundation has done, what are the different ways that you see success? Like, how do you measure the success of the foundation? That was one of the questions, is measuring success despite difficulty.
Yeah. Well, we measure success in both numbers and stories. Yes, numbers, it's really matters. How many students supported, how many programs delivered, but more importantly, uh, success is when a student continues, when the student continues their education, when a doctor stays in the system, when hope continues despite everything. In our context, continuation itself is success. And I don't know if you hear about Samir scholarship in the last year. Alhamdulillah, we covered more than 100 medical students in their tuition fees for more than $100,000. Alhamdulillah.
Excellent. And actually, on that note about funding limitations, do funding limitations affect your foundation's work? Is that one of the difficulties that you're
Yeah,
encountering?
absolutely, yes. Yeah, but because, as you know, funding limitation directly impact how many students or how many doctors can support and how fast we can respond. So, for example, we often have more students in need, then we have resource to support. This means we are constantly making difficult decisions about like he is more important than other. So because we are trying to move from emergency response to long-term system building.
Mhm. That makes sense, like the structure. And on that, actually, is there currently a committee or a structure within Samir Foundation that helps you do this work, helps you select students or identify students? Or are you currently carrying that work alone mostly right now?
Yeah, like we have a criteria for select students, or what do you
And do you
mean?
have a team helping you to select? And also, yeah, could you talk about the
Yeah,
criteria?
yes, we have a team. We have more than 30 members of our team. Some of them from digital marketing, some of them from medical background, and some of them like advisor for medical education and ambassadors. And also our ambassadors in the outside of Gaza, they help us uh, very important.
Okay. Um, is internal coordination a difficulty for you? For example, keeping your phone charged and connecting through the internet, messaging each other, network failures, things like that. Is that something that is a challenge right now in Gaza?
Actually, now at the meantime, absolutely yes. One of the daily challenges we face is simply staying connected and operational during the war. So things that may seem very basic elsewhere, like as you say, charging a phone, accessing internet, or even sending messages to coordinate with the team, with the ambassadors, now become major obstacles here. So there are frequent networks failures, electricity shortages, and communication blackouts. Sometimes coordination between hospitals, students, or team members become extremely difficult simply because people cannot communicate constantly. And during escalations, even accessing the internet safely becomes uncertain. These challenges affect not only our operations, but also education, emergency coordination, uh, and so on. So yes, logistical and communication barriers are a very real part of our daily work.
And can you tell us a little bit about how you handle this? Like, how do you charge your phone right now? How do you make sure you have that?
Yeah,
How is your internet good right now?
yeah. Uh, some of some of tent around us, like they have a solar system, okay, and they like some of people go to that tent and charge their phones, and then you return to your home. But when you return to your home, you have a limited work, because if you spend a lot of hours in your laptop or in your phone, they will be empty. So that's what people are doing now.
So even now, this meeting and the meetings to prepare for this, you had to make sure you had charge and you were
Yeah,
available.
exactly. Yeah,
That
and the internet, like also from a connection. Most of the neighborhoods are connected at the same internet.
okay. Um, let me see. We have a lot of questions coming in. A few are relating to the Samir Foundation expanding. So, do you envision the Samir Foundation to expand to work with all students in Gaza, not only medical students, or is the focus medical students and healthcare at the moment?
Yeah. At the meantime, after, as they say, ceasefire, our primary focus is medical students and the healthcare sector because Gaza is facing a major healthcare workers crisis, and all all people around the world know that. So we are trying to ensure that the next generation of doctors, nurses, and healthcare professionals can continue their education despite the war and destruction. But at the same time, we absolutely recognize that the impact of this war extend for beyond medical students alone. In the future, I do envision the foundation expanding its impact more broadly, especially in areas like just dentist and pharmacy students, youth empowerment, rebuilding human capacity in Gaza.
Mhm.
So for now, our core mission remains focused on strengthening healthcare system and healthcare education.
Mhm. Thank you for that. That makes sense with the mission of the organization. And along that same idea, so you're supporting the personnel and human resources. There's a question about the medical equipment. Is how do you work around the challenge of acquiring the medical equipment and medications that you need to use in the hospital? Can you talk a little bit about that?
Yeah, acquiring medical equipment in Gaza now uh, currently is extremely difficult because the border restrictions, as you know, and there's supply shortages and the destruction of infrastructure during the war. Even when equipment is donated, transport transporting it safely into Gaza can take a long time and involves many logistical obstacles. In some cases, equipment that would normally be considered basic in other healthcare system becomes incredibly difficult to access here. So we work through partnerships with international organizations, medical donors, and humanitarian networks to identify what is most urgently needed and to try to coordinate its delivery as efficiently as possible. And the main medication or the main shortage in medication is for DM so for these diseases and the patients of these diseases are very critical due to the shortage of the medication.
Yeah. So is there, when you're diagnosing somebody and you need to give them medication that is not there, what do you do in that situation? You just,
Yeah, currently there's some organization that can get the medication inside Gaza, like WHO and so on. So
Mhm.
sometimes we try to alternative medications if available. Sometimes we prioritize the most critical cases, and sometimes we rely on improvisation in ways that should never be necessary in a functioning healthcare system. Uh, so that's one of the reasons why rebuilding healthcare infrastructure and ensuring access to medical supplies is such an important part of our mission today.
And what about vaccinations? Is this also an issue? How are vaccination campaigns going? Are you able to give regular vaccinations and avoid the spread of diseases like polio and things like that that can be vaccinated against? Can you talk about that a little bit?
Yeah, in the meantime, I think this is a question is very related to WHO because they have the answer of that, not me.
Okay. So usually the WHO is who takes care of the vaccination
Mhm.
campaigns. Um, relieves that. There was a question asking if you are now a doctor and where in Gaza are you based? And I will say yes, as a medical doctor currently working in Gaza City. Um,
I am in internship in the Gaza city.
mhm.
I'm still in the internship and I will get official inshallah at the end of this year.
Okay, so you are currently training through an internship and you hope to get your
Yeah, exactly.
license at the end of the year. Excellent, thank you. I was wondering as well about how, excuse me, how you have such a successful global network of supporters, and how did you go about establishing the relationships with the global network that you have?
Uh,
Can-
Actually, my main network, I take them from the platforms, from the LinkedIn, from the Instagram. And honestly, building this global network happened very naturally through storytelling, advocacy, and shared purpose. Uh, During the war, I began documenting what was happening inside Gaza, especially inside hospitals through social media and public speaking. So I believe people connected not only to the tragedy itself, but also to the human side of the story. So the resilience of students, doctors, and so on, trying to continue despite impossible conditions.
Thank you for sharing those stories. Going through them and then experiencing it again when you're sharing them. I want just to thank you for giving those people a voice, and helping reach us as well. So thank you so much for that.
For sure.
Um, there's a lot of people on the chat who would like to support. And one of the questions here is wondering if there's a way to set up some Zoom meetings, virtual meetings with medical groups and your program to introduce it to medical groups. And so maybe this could be what is the best way to reach you, and if you're open to collaborating or having meetings with medical programs, medical groups.
Can I can write down my email, and they can send their perspective, and we can discuss about it, inshallah. So, but absolutely, we'd be very happy, inshallah, to coordinate sessions introducing the Samir Foundation and sharing the realities of medical education in Gaza and from medical students themselves.
Excellent. Thank you. And I also thank you to Rosanna, one of our co-hosts with Scientists for Palestine, for posting more information
I
in
will
the chat.
I will send my
Yeah.
email.
Excellent. We will also include the contact information on our website along with the recording of this talk. So please continue sharing this story as well. Let's see. We just have a few more questions left. Since we have the time, I would like to make sure we have all the questions answered. Thank you, Ezz, for sharing your email. There is a question about wondering so were you supported by the EU, by the European Union as a medical student before the genocide started, since you mentioned you were EU ambassador? And does the EU support you now with your work?
Before the war, when I was submitted as to be selected as the EU Goodwill Ambassador for Palestine, uh, was more related to advocacy, like youth engagement and social impact work, rather than direct institutional or financial support for my medical education. So it was just an opportunity to represent youth voices and community initiatives, and it helped me strengthen my experience in leadership, communication, and humanitarian engagement. Uh, as for the present moment, the Samir Foundation work independently through partnerships, collaborations, and support from individuals or organization and global networks who believed in our mission.
Right. Then the final question that we have, and if you have final comments, oh, it looks like we have a few more coming in, but what, let's see, are there organizations that you currently collaborate with? Could you give the examples of some of those organizations if you can think of them? And also if there's, actually, yeah, let's start with that one. Yeah, what other organizations have you worked
Yeah,
with?
but one of most important organizations that we partner with them, like Doctors Against Genocide and Human Smile, HCI, Salam Charity, Shinta Gaza Malaysia, Fajr Global, and several medical education and mentorship initiatives.
Okay. We've heard about uh, the abduction of medical staff by the Israeli army and some of the torture that they have been subjected to and the detention. Someone is wondering about whether uh, trying to seek accountability for the treatment and abduction of medical staff is something that we should be working on. Is this something your organization, like the advocacy from that side, to tell the stories of staff and
Uh,
targeting of staff?
Actually, healthcare workers are supposed to be protected under international humanitarian law because their rule is purely humanitarian. So they are here to save lives, regardless of politics or identity. But during this war, we have witnessed repeated reports of medical staff being detained, abducted, injured, or killed while carrying out the work. Uh, as for accountability, I believe documentation and testimony are extremely important. Many organizations, human rights groups, and healthcare professionals are working to document what has happened to medical staff and healthcare institutions during the war. So Yeah, and honestly, one of the reasons I continue speaking publicly is because silence can normalize these realities. So medical workers should never become targets simply for trying to save lives.
Okay, thank you. And speaking of also just the mental health and of medical workers, especially, thank you for sharing your personal stories of grief. If I may ask a personal question, if you're comfortable answering, and how do you express your grief, or um, have you found ways to mourn your family members who have passed since uh,
Yeah, express what?
um, let me ask it in Arabic and I'll translate. um, إنه عشان لسه ما بتقدرش إنه تدفن أهلك وعيلتك
Mm.
وإنت تودعهم، في طرق أنت عم تستعملها إنك تودعهم وتتعامل مع اللوس، هذا الgrief. How do you honor
Actually,
family members?
in my case, my family is still under the rubble, so part of my grief feels unfinished, you know. So like there is still no real closure. I think for a long time I expressed grief through work, through continuing, going to the hospitals, helping people, building Samir Foundation named on my late father. I also express grief through storytelling and speaking publicly, because I feel that keeping their memory alive matters deeply to me.
Yeah, and you are definitely are doing that with such a wonderful foundation and work. To thank you everyone for the questions, and thank you so much for spending this time with us. We know it's not easy to take that time and the power. We appreciate it. And just to wrap up, um, uh, I wanted to give you a chance, just if you have any final words to say, and if there's anything that you would like to make sure the listeners do that would make the biggest difference for you right now. If there's any action you would like us to take that would help you the most in this moment, or if there's anything you would like to say. So yeah, as if there's anything that you would like to make sure we take away from this, I'll give you the final say.
We just thank for everyone who is attending now. And as I said, don't let our stories fade in silence, because we are trying here to build a new generation of medical students and doctors, and also we need your support, not your support like as donation, but we need to your support as to raising your voice, raising awareness about what is happening here, and don't forget us.
Thank you so much, Ez. And thank you, everyone. Please share this talk and donate to the Samir Foundation and donate your time and participation as well. Thank you so much, Ez. Best of luck. We wish you all the best. We appreciate your time.
You're welcome, Dima. Thank you so much for your effort.
Bye bye.